over 800 beds, UMass is the largest healthcare system in central Massachusetts. It is an academic medical center and the clinical partner to UMass Chan Medical School. The medical center itself consists of 3 campuses: University, where you'll be doing most of your learning experiences, your office is located, and on-calls will be done, as well as the Memorial and Hanneman campuses.
Hello and welcome to your tour at UMass today. My name is Liz Radigan and I'm the Director of Clinical Pharmacy Services. Today I'd like to talk to you a little bit about UMass and the culture. One of the things that I love about UMass is our people and our culture. In fact, it's one of the reasons that I chose UMass for my residency training many years ago. Our residents, pharmacists, and technicians are vitally important to providing safe and effective care for our patients. And our pharmacy teams here work very closely with colleagues within and outside of the department to achieve our goals. Often we are looked upon to lead new initiatives within the medical center. It's also really important to note that the standards of respect are a part of our culture here at UMass, and that goes within the pharmacy department and outside. What are those standards of respect? Acknowledge, listen, communicate, be responsive, be a team player, and be kind. This is really important to us, and having a welcoming environment and an open door policy for feedback for our residency program is a really important component of improving every year. Our residents play an important role as part of our UMass team, and we're very proud of our residency program and the well-rounded education that our residents receive by participating in different clinical services, as well as many other initiatives. We have many teaching and learning opportunities for our residents throughout the year, ranging from journal clubs, case conferences, teaching seminars, and many others.
Hi, my name is Allison Forney, and I am a clinical supervisor for the UMass Department of Pharmacy. At UMass, we pride ourselves in knowing our graduates are ready to tackle a variety of roles. We've had graduates go on to pursue positions as a clinical specialist, as well as roles within academia or as medical science liaisons and roles within leadership. In addition to the usual residency experiences, such as research projects and quality initiatives and teaching certificates, we offer a 24-hour in-house on-call program during which our residents are at the bedside responding to traumas and code blues and code strokes. This helps mold a dynamic, lifelong learner that is independent in the most demanding of situations.
Hi, my name is Mike DiNapoli and I'm one of the ED pharmacists. UMass is a certified Level 1 trauma center as well as a comprehensive stroke center. Our pharmacy residents attend all adult and pediatric, inpatient, code stroke, and code blue activations during their on-call shifts. In preparation for these activations, during the orientation period, our residents undergo a vigorous mock code as well as code stroke and trauma training program.
As an ICU pharmacist here at UMass Memorial Medical Center, it's a very collaborative group on a daily basis, rounding on our patients with nurse practitioners, physician's assistants, our physician colleagues, as well as our surgeons. It's a time where we come together to provide the best care for our patients, having discussions and thoughtful discussions about what is the best, safest, and most efficacious approach for our patient on a minute-to-minute and day-by-day basis. With how well integrated our ICU pharmacists are already with the medical team, it's a pretty seamless transition for our residents to be built up and to get to that independent role, especially while rounding, and become the point person of contact for questions and follow-up throughout the afternoon and evenings with our medical teams and our provider colleagues. We have a very diverse cardiology patient population here at UMass. From the cardiac ICU to the heart failure and general cardiology wards teams, there's a quite diverse patient population that our residents encounter on a daily basis, whether it's through the inpatient anticoagulation consult service, whether it's through rounding with us for cardiac surgery rounds in the morning, to rounding with the heart failure team both in and out of the hospital. We follow our patients through and out the door, including follow-ups in the outpatient setting, at our heart failure clinic, and our transplant clinic as well.
At UMass, we have a focus on quality and safety integrated through our organizational and departmental goals. Many of the longitudinal projects our residents work on are actually derived from our safety initiatives. And through their training, our residents learn how to approach safety issues through a systems and multidisciplinary approach. And with this skill set, our graduating residents are better equipped for their future roles as well-rounded practitioners.
I'm the PGY1 Residency Program Director at UMass, and I am also one of our acute care pharmacists. Our residency programs support the residents' transition from student to new pharmacist, or PGY1 to PGY2. Each resident is assigned a staffing mentor who helps them to navigate our pharmacy operations and our electronic medical record. Each resident also is assigned a residency mentor who helps support their personal and professional development throughout the year.
So we have a preceptor and resident mentor program in which a resident is paired with a preceptor to act as their mentor for the rest of the year. It's great in that the resident can talk about things that they normally may not feel comfortable talking about with their either rotation preceptor or residency director or even residency coordinator. So things like career goals, life lessons, anything and everything. And it's a lot more informal.
Hi, my name is Avi Bakchi, and I'm one of the PGY2 residents in the critical care program.
Hi, my name is Brittany Block, and I'm one of the PGY1s here at UMass.
The reason why I chose UMass for PGY2 in critical care is because we get all of the variety of experiences that you get at any large academic medical center with more of a small town vibe that you get from one of the larger programs in a big city. We have 7 adult ICU rotations, 1 in a pediatric ICU, a neonatal ICU, as well as lots of time in the ED on your mandatory rotation at the beginning of the year, as well as trauma response during your 24-hour on-call shifts and in the weekends when you're staffing.
I chose UMass for my PGY1 training because I was looking for a residency at a large academic medical center, and I knew coming in I had an interest in critical care, so I really liked the opportunities that this program provided, including the 24-hour on-call program, in addition to knowing that I would still get a well-rounded PGY1 experience. One of the highlights of my PGY1 thus far has definitely been the large residency class that we have here. So this year we have 6 PGY1s and 5 PGY2s, and you really have this built-in friendship with people that are going through the same experience as you. So there's always someone there to kind of help you or give you support when needed, but also to have a good time as well.